Welcome. My name is Jerry Williams, and I am the founder and president of Myositis Support and Understanding, the nonprofit organization that you know of as MSU. And I would like to welcome you to episode 1 of Managing Your Care Starts With You, which is a new webinar series with Dr. Salman Bai. We have titled episode 1, Communicating with Your Doctor as a Myositis Patient. And this evening, Dr. Bai is going to talk more about how the doctor and patient relationship is changing in myositis, what you should expect, how do you make your voice heard, and we'll also take questions that have come in from registration and questions that you might have after we talk with Dr. Bai. My colleagues from Myositis Support and Understanding joining me tonight are Lynn Wilson, the Vice President and Director of Patient-Centered Research, Manuel Lubinis, Patient-Centered Research Advisor, and Emily Fillmore, Co-Founding Director and Advisor to the Board of MSU. And they're going to assist me when we get to the questions and the Q&A that I just talked about. So now it is my extreme pleasure to introduce you to our medical advisor now, Dr. Salman Bai. Dr. Bai is an assistant professor in the Department of Neurology and Neuropathics at the University of Texas Southwestern Medical Center, and he's a faculty member at the Institute of Exercise and Environmental Medicine at Texas Health Presbyterian Hospital, Dallas. Part of Dr. Bai's bio is that he's grateful for the unique neuromuscular mentorship training that he had under several of the neuromuscular experts, including some that we all might know in the myositis space, Dr. Anthony Amato and Dr. Stephen Greenberg from Brigham and Women's Hospital. Dr. Bai specializes in the evolution, diagnosis, and treatment of neuromuscular diseases. He specifically focuses on patients with inflammatory and metabolic myopathies, as well as those with immune checkpoint inhibitor complications. And his research focuses on understanding how muscles communicate with other organ systems, particularly when a muscle is inflamed, like with myositis. So I don't want to go on and on, but I could. Dr. Bai has a ton of wonderful information and just his research. The goal of his research is to better understand, diagnose, and treat patients with myositis. And as if you've read any of the articles and releases that we've put out, he is dedicated to helping patients and their families understand and navigate difficult conditions by providing world-class clinical care. And that's part of our discussion tonight. So welcome, Dr. Bai. Thank you so much for joining us.
Thanks for the kind introduction. And that was long-winded, and hopefully people stayed on there and we can get to the content here. And a special thank you to the MSU staff. They do a great job about putting the series together, education for patients, and really trying to get patients the best care and education that they can get. As a physician seeing these patients, I understand some of the biggest issues that you may have is the patient-doctor relationship, right? It always starts with the patient and how to communicate what it means to have myositis, to be diagnosed in the first place, and then how to get the treatment that you deserve without hopefully traveling too far. I know that's a concern too with the lack of myositis experts or specialty in a lot of different areas. So we'll talk a little bit about how to navigate this and to help you treat your condition the best way possible. I put a little picture up here just to start off with a bit of a laugh that you probably have encountered, so perhaps it's not too funny. But sometimes you may have seen your doctor take a look at you and say, well, this is not one of the things that we learned in medical school. And it's not a lot of things that people learn during residency or their fellowship training. And so that's the challenge that you face sometimes. And so step 1 of how do we get to diagnosis, treatment, and then ongoing management, I think with the relationship in mind, to establish what your goals are. As a physician, I would say my goals are control the rash, improve the CK, help the strength over time, prevent lung issues. But the bigger picture is how can I help you live the life that you want to live, right? How can I help you achieve your goals? And if you don't express those goals, that can be difficult to understand. And perhaps it's not always just about CK. Perhaps it's about another aspect of your life that we can address through physical therapy, support staff, or modifications to your home, but without having that discussion or having those goals in mind, we want to make sure that we're working together about that. Another thing to think about is what's being addressed and what's not being addressed, similar to your goals, but to really understand and meet your healthcare team in the middle. Um, we want to know what patients want, we want to know what their caregivers want, and we want to work together to achieve those goals and whatever's not being addressed. So I think at least establishing that relationship and establishing that groundwork for this is what's important to me, this is what's not being addressed. Perhaps it's pain, perhaps it's fatigue, but bringing that to light and then working with your team about that. Along those lines, it's about concerns and hesitations. You may have noticed that perhaps you have a hesitation and your doctor had prescribed something or recommended something, but that's something that you did not want, and that can lead to frustration in the relationship. I think just being open about it and to say, this treatment bothers me for reasons X, Y, Z. I'm not adherent to this medication for this reason. Can we try something else? It's not about your physician making you comply with something. It's about you adhering to the treatment plan, a treatment plan that you come up with your team. And so it's a two-way street. And I would just try and keep that in mind as you work with your doctor to come up with the ideal plan for you. There's some questions later on that talk about this, and we'll go back over that. And then this is really a team effort. Not every doctor will know all aspects of this disease. Even specialists will seek help from other specialists. And so it's important to have that team. Part of this discussion about your goals, your hesitations, what needs to be addressed, that's difficult to have sometimes if the physician you're working with is not well experienced in this disease. And so that's why I think it's important to have that team. Other diseases, cancer, ALS, and several others have a multidisciplinary team involved. And I would say myositis patients similarly need that multidisciplinary team, something we'll talk about later, but know what that healthcare team is and advocate for that healthcare team. And similarly, it's not just about the healthcare team, it's about your support outside of the hospital, outside of the clinic, and outside of the healthcare realm. It could be your caregiver, friends, family, but it's important to know who's there for you mentally, emotionally, and physically if and when you might need that help. And they also need that support for themselves. So it's important to just keep that in mind to round out that team and make sure everybody is playing an important role to help you heal and to try and move past myositis. We talked about that multidisciplinary team. I'll list out a few of the factors there and who can be involved. And then I would say with COVID, if there's a silver lining here, there's not many, but telehealth is becoming easier. And at the same time, it's a little bit harder. Easier in the sense that you may not have to travel as far to meet with somebody who treats myositis patients, whether it's just a one-time, here's my chart, can you give me your opinion? Or it's let me read your chart and then come over and I can examine you. The hard part here is that with televisit, we can't examine patients the way we would in person. And that, as you know, makes a big difference for myositis. But at least having that connection, if you've seen somebody once, traveled, and then connect with them through telehealth, that can be, I think, key in your health to meet with somebody who knows how to treat myositis. I'm going to click to the next slide. Nope, I cannot. There we go. All right. So myositis is a team effort here. I list this picture here of the different kind of weaknesses that IBM patients get, and I use it as an analogy. These myositis, these myositis issues are not just muscle diseases. Patients are affected, you are affected in multiple different domains of your life, whether it's financial, whether it's stigma, whether it's feeling not included with friends and family. So yeah, it's a muscle disease, but just like other organ systems get involved, other domains of your life get involved. And so I listed out a few different components of what your team could be. And what I would say is try and start with yourself and be honest, take a step back and say, Is my mental health where it needs to be? Uh, I would say most people can probably use some kind of counseling, not just myositis patients, but everybody, right? This is a tough time in everybody's lives. And so I would say if that's something that you can use assistance with, whether it's a dog or a counselor or exercise, whatever you need to do to take care of yourself, I would advocate and try and make that happen. I list caregiver support because that's right next to you, right? And if your caregiver is not doing well, it's hard for you to be cared for. And so just keeping in mind that the caregivers also need help and support, and that's physical, mental, emotional, all aspects of health need to be addressed for a caregiver because myositis isn't a sprint, as we all know. It can last years, there's flares. And so you really need that close knit support that you have, and that support should be strong. I mentioned financial barriers here. I've run into where patients have issues getting tests, medications, modifications that need to be done. So I would make sure that that's not kind of slid underneath and mention that to your doctor, your social worker. Different organizations, MSU, TMA, others may offer financial assistance. So keep that in mind and don't let a financial barrier get in the way of your treatment. There are avenues, and your doctor can help advocate for you to get what you need and make sure your disease is treated properly. Outside of the clinic, this is a big one, and I notice there's education's happening. I think patients are more aware of this than doctors are, but exercise is key, right? It sounds almost silly and dumb that I'm even saying this because it's a muscle disease, and to help keep your strength up, it's good to exercise properly. But the healthcare field doesn't exactly understand that all the time. There was this long period of thought that patients with muscle diseases should not be exercising. And while there's certain kinds of exercises patients shouldn't do with this disease, for the most part, it's safe and beneficial. And if your weak muscles are not necessarily getting stronger or reversing the disease, it's still helping other muscles with stability and trying to make up for the weaknesses that you do have. And so that's working with a physical and occupational therapist, also working with a speech and language pathologist to make sure that your swallowing issues, if you have them, are managed properly. Working with social work to address your psychosocial needs, your financial barriers, and then nutrition. That's part of self-care as well. And then the clinical team comes further down, right? I think you see your doctor every now and then, but the other folks that I listed above that, you'll probably interact with more often. And so there's a huge team involved: physicians, nurses, NPs, PAs, students, trainees. And I included students and trainees because that's the next generation. For myositis care to improve requires the future generations of healthcare workers to see patients like you and for you to teach them. And so that when they see a patient like you, they know how to deal with not just the medications, but the whole patient, right? That holistic care. And then after that, it's advocacy groups and research. And that's up to you if you want to be involved. But this is a rare disease, and having patient voices to tell others what this disease is like can really change how people perceive it, the funding around it, and the research around it. We'll talk about momentarily what research should look like, and it should include patient voices and direction with it. So just a brief on treatment. Treating the whole patient is important, right? It's holistic care that starts with you. Yes, your doctor has to diagnose and start that treatment, and those medications are important and necessary. But other aspects of care include self-care. And I listed complementary practices here, but they're also primary in the sense that these are things that you should be doing for yourself. Studies have shown that exercise is anti-inflammatory. It helps with outcomes. It helps your strength. Doesn't necessarily reverse the disease, but it's not going to make things worse for you if you do them properly. And I mentioned exercise for your mind and body, and I listed mindfulness practices. So I purposefully put that there twice because taking care of your mind, right, the mental health component, will really change how you're looking at your disease, but also interacting with the other parts of your life to help you improve from your disease state. We don't want you necessarily sitting around because you're in pain, because you're weak. Those are issues, and that should be addressed with your doctor, your healthcare worker, your entire team. But getting up, exercising, moving around, socializing, I think those are important. Socializing safely. Get vaccinated for COVID. But regardless, you should be socializing and spending time with friends and family. And then being open with your team about your needs. So say you wanted to try a different kind of non-Western medication, a supplement. I don't think you should necessarily shy away. I would just discuss it with your team. Some medications have interactions with non-pharmacologic medications. And so I would just be careful about that. And so there's nothing to hide. It's your treatment. It's your plan that you develop with your doctor. Just have an open conversation. And then I mentioned the research component. All right, so what does myositis treatment and clinical trials look like in the future? Well, one, it should be partially guided by you. What's important to you to see change in your disease, right? I think from our end, we look at certain biomarkers to say, is the disease getting better or not? But regardless, if that's not changing your activities of daily living, or if you find that my pain is not being addressed, I still have a lot of fatigue, the rashes are not necessarily getting better. All of these factors play into what successful treatment should be. And that's only known by us doctors communicating that, but that happens because patients communicate it to us. And when patients are able to get involved in research into explaining what these outcomes patients would want, then that's very helpful to help guide what we look for in trials. And that goes along with what's not being addressed in your disease. That depends on you and what you feel is important. And then participating in research is important. And it's up to you if you want to or not. But with a rare disease, there's different levels of participation. It could be a survey. It could be a non-interventional study where we're looking at the effects of exercise on you. So we're not giving you a drug, but we're just seeing what happens if we follow you and look at various markers or patient-reported outcomes. And then there's clinical trials. We all hope for a more targeted treatment and drug to help treat the various myositis disease categories. And that can only be known through clinical trials. And then, the big picture here is just working together with advocacy groups, working with your doctor, and working with researchers to bring about change in this rare disease. And some of that happens through biobanks. Several centers will collect samples when you're normally drawing blood, and that can be used for studies later that can help guide treatment, understand biomarkers, and then guide management in the long term.
Dr. Bai, would you speak to how important it is for patients to do surveys?
Yeah, I think there's definitely a thing as survey burnout, right? There's too many questions. Right. It's hard to focus, but I think they bring about your perspective in a way that's hard to capture otherwise, right? So if you tell your doctor, hey, X, Y, and Z doesn't seem to be addressed, these are issues that I have, that might just kind of end up in a note and sitting there that's not brought out later, or the doctor may forget about it, or it's hard to compile it all together. A survey allows us to quickly compile that data. So if 400 patients are telling me my pain is just not being addressed, and it's not the focus of my treatment at all, well, that's a interesting finding. And that gives us a new marker, a clinical marker, to say caring for myositis patients requires that we also address this. And so different surveys can address different facets of your disease and can help us really nail down different avenues of diagnosis, treatment, management, just that holistic care.
Thank you. Yes, we appreciate, if you're listening tonight, you're living with myositis, or, if you're a caregiver, depending on the surveys, we have a few different survey opportunities available now. Yes, make your voices heard. We have these lived experiences, and like Dr. Bai said, we don't want them sitting in a chart somewhere if they could be helping other people. So, read the privacy terms. It's usually confidential or anonymous, one of the two. Please, yes, that's a great way to get involved.
And I think it also is helpful because we capture different voices. Healthcare disparities are pervasive in medicine, not just in myositis, but everywhere. And it's probably even more magnified because of it's hard to get to certain centers. It's hard to get a hold of certain people. It's hard to get all the resources. And so understanding how it affects different ethnicities, different socioeconomic statuses, different education levels, I think all of these just add to the evidence that when we work to address them, we can say, look, we asked these patients, this is what we found, and that's the evidence that we could use to then generate different models of treatment or different studies to help address those issues.
Excellent. Thank you. Really appreciate it. Did you want to move into the next section of questions and answers, or do you have anything else that you would like to talk about first?
No, I think we can move ahead. Just the big summary of all of that is that uh, it can be difficult to navigate the system, especially when you're ill and it feels like life is falling apart, and it's hard to keep it together with all of what's happening around us. I feel your pain. I know how difficult it can be. Um, just try and work on yourself, work on your team, and then over time, I think if you can do that, hopefully you can help guide treatment in the right direction for you.
Yes, and utilize our support groups. That's what we're here for.
Yeah,
We're
they do a great job about connecting people to resources. MSU has some great education tools on here as well, and connecting you to the right people if you need.
Thank you, Dr. Pai. All right, so the first category of questions falls under what we talked about at the beginning, the patient and doctor relationships. Do you have any tips for better supporting or establishing expectations regarding the primary care specialist interface, chronic condition care management, continuity, coordination of care, et cetera? And she has clinical amyopathic dermatomyositis.
That's an excellent question. The most frustrating thing that I see, and that I imagine patients feel frustrated by too, is the lack of teamwork, right? We just talked about a team, and then there's no communication with the team. That doesn't work in sports. It's not going to work in medicine. Uh, what's important here, I think, is just telling your team that, can you please send your note to X or whoever it is? Uh, Admittedly, even when I have done that or patients have asked me to do it, sometimes the other person doesn't see it. And so in that situation too, you can have a after visit summary where you have a quick summary of what the visit was about. And you might show that to the next doctor that you see. Some patients have a quick notebook of important things that have happened, right? So if you saw your neurologist, this dose was changed, things look good, and that's the summary. I know some doctors can get frustrated if you may have experienced this uh, when there's too many records or it feels rushed or uh, there's pressure to read education materials. I think that's your prerogative. I think you should share those materials, and um, it's important for you to get across what you need. So I think that's something that you should do, that you should share, and set the expectation that please send my records to, and you can include you can have the fax number to make it easier. That chronic condition management happens through that teamwork and making sure that the right people are involved. Communicating with the physical therapist, the occupational therapist, nutrition, social work, everybody is part of a big team. And you need a quarterback. You need someone to lead the charge there. In in myositis, it's typically a rheumatologist or neuromuscular specialist. There may be a pulmonologist involved. There may be a dermatologist involved, but having one point person, I think, is important so that there's not diffusion of responsibility, right? One doctor doesn't think someone else is managing it when that other doctor thinks somebody else is managing it. So that can be helpful as well. And then that coordination of care, being organized yourself. Uh, you may be going in and out of so many appointments, it's difficult, but to have a clear calendar of when you're seeing somebody and a follow-up is scheduled, if you're being referred to the right place, that can be helpful as well.
Thank you. And I would add, adding, a list of your current medications, making sure that you have something, we found it very, very helpful when we talk about it in the groups of creating some type of a system, so that you are showing up for yourself and for your team. So excellent there. I want to just kind of add on to that question. It really is not about that, but reminds me of a situation that we see a lot, and that's with hospitalists. Say we get admitted to the hospital, and I know sometimes there's no trust because we don't know who this doctor is, and we have such a intimate relationship with our doctor, but they can't come to the hospital or don't come to the hospital. Is there anything that you could offer us as far as how maybe we could approach that relationship if we're obviously conscious and able to?
Of course. And the hard part is you don't want someone drastically altering your medications without really knowing what the disease is and just saying, hey, this is inflammation, let's throw some more steroids on it and we'll get you out of the hospital. I think there's two processes here. One is trying to coordinate that care, and two is education. And so, a short summary, if you have it, a paragraph of something that just says, this is my disease, this is what I take, this is my diagnosis, this is my doctor, this is the contact information. I think having that can be useful. And then the second thing could also be where you are able to reach out to your doctor and say, I'm admitted, this is the issue, or your caregiver can do this. And just saying, this is what's happening. So having that input from your doctor can be very useful. They may even write back to say, I will contact that doctor or pass on my recommendations, or let the other hospitalists consider these recommendations. And so that communication is very important. It's hard to do sometimes, especially in today's medicine culture, unfortunately, with all the burdens healthcare workers face. But I do think it's important to just reach out, and I think most doctors would want to hear because they care about you.
Wonderful. Thank you. I appreciate you touching on that. The next question I have, let's see, I've had a new rheumatologist for a year now. He doesn't seem to want to hear my questions or comments. Feels like he, quote unquote, knows it all. My old doctor was great. I was diagnosed in 2003 with dermatomyositis. How do I reach him?
It's a good question. I imagine it's a common experience, unfortunately, where the relationship just isn't working, right? Where you feel like you mention a concern and perhaps not listened to, or it's just part of a checklist and it's not being addressed, right? That long list of review of systems that you answer before you come in, and then the doctor asks you the same stuff again. I've been guilty of that, and some of that stems from the amount of paperwork, time pressure, et cetera, but that's not an excuse to not hear you when you're saying something, right? So if you feel like the relationship isn't working, you could look around for a different recommendation for a doctor. You could mention it to your PCP. You can bring it up to your rheumatologist and just say, hey, these are my goals for care. These are my issues, and I feel like X or Y is not being addressed. Can we please work on those? I think being direct can be helpful. And, I don't take offense. Hopefully your doctor wouldn't take offense either. It's about helping you. And so I imagine your doctor's invested in doing that. So I would just be upfront. And if that doesn't work, I would talk to your PCP about potentially other options.
Wonderful. Thank you. I think that's it's one of those where you get into some of this small town living, like with where I'm living, there is one rheumatologist, so it's sometimes we feel stuck.
Yeah.
And I know, because I know this comes up a lot. So
yeah, absolutely. Telehealth can be an option. There's neuromuscular specialists also see similar cases that might give you another avenue. But you may also find that if it's not exactly related to your myositis, that working with a different subspecialist or your PCP may be able to address the issue. And it doesn't necessarily have to be a doctor. If it's certain kinds of musculoskeletal pain due to muscle imbalances, your physical therapist may be able to help you as well.
Right. Wonderful. Thank you. The next question. I was diagnosed with anti-synthetase syndrome 6 years ago. I would have liked my doctor to have shared physical exercises and dietary suggestions. Also, would have liked to have informed me of resources online, which would have added to my understanding, including the Myositis Support Understanding MSU website and support groups.
Yeah, that's, it's a tough issue that we face, right? Where doctors aren't always fully educated about it. And they may be, and they may not have just shared something. And I think some of that comes from the doctor should just do that. That would be helpful, I imagine, getting more information. But from your end too, to say what other resources can I take a look at to understand. Unfortunately, or maybe fortunately, things are easy enough now with Google, where you'll just type in myositis support and or myositis education or just myositis, and resources will come up. It would be much better if your doctor pointed you towards some. That way we know what credible resources are. But I share your frustration. I understand. I think I've seen patients that were misdiagnosed or not told about certain exercises and are just being treated with prednisone and methotrexate or whatnot. And there's more that can be done. So thankfully, there's groups like TMA, MSU, and then other support groups where you're having patients, helping patients.
Absolutely. And this is something that we have talked about in the past, and it's just it's something that we've seen with at least one member who was diagnosed. She was given information about MSU, and she has felt supported throughout the entire process. So we know it works. We just have to get the information into the doctor's hands to be able to provide it, I guess.
And the dietary, the dietary suggestions listed here, there's a question: is there a specific kind of diet that you have found works best for myositis patients? Any particular foods we should not eat? Diet perplexes me even more than myositis. It's a hard question because it's hard to study. And I think my advice that I give to patients is that keep it simple. Eat foods that go bad, meaning it's not processed. Eat a colorful plate, half full of fruits and veggies. So you're getting lots of fiber, you're getting heavy nutrients. Cut out red meat as much as you can. I think fish is great. And if you're not eating meat, more vegetables, the better. And try not to overindulge. You should still enjoy your food, but eating in moderation, doing those habits can be helpful. I think people point towards the Mediterranean diet, which I think is great. I think overall, there's if you Google it, you'll find anti-inflammatory foods. I think it's not fully studied and understood well, but do what makes you feel good. And the goal too here is to not add to your cardiovascular burden, right? Heart disease happens with myositis, we know, because of the inflammation. And so even if it's not necessarily helping your muscles per se or your inflammation, I would want you to eat healthy and exercise to help prevent other kinds of consequences related to myositis, which is obviously hard to do when you're on prednisone and gaining weight. And so you have to be extra careful.
Right. And then if you're lucky like me, you get the steroid-induced diabetes, and then the sugar becomes the challenge.
That's right. That's right. Yeah. It's so difficult, and it really requires a nearly impossible ask to eat in moderation, eat healthy, and try to exercise.
Excellent. Thank you. Lynn.
Yes.
Lynn's going to take us through some questions.
Yes. First up, question about pain. How do you discuss pain management for myositis given the concerns with opioids by doctors?
It's a great question, right? And sorry, I cut you off there, Lynn.
No, I was just going to say, obviously, the person who asked the question wants to know how they can have that conversation with their doctor.
Yeah. So it's a great question because it's one that should be addressed. And I think, I never prescribed opiates for pain for this. And, you might have other issues that might require it. But if you've gone that far, I think you've perhaps either missed out on other medications that could have tried or other therapies, or your pain is severe and there's other factors that you may need a medication like that. But I think there's several options that you could try and work with either your doctor or pain management to go through various different kinds of treatment options. And so I wouldn't necessarily, I don't know if this happened to you, but I wouldn't necessarily associate if a patient asked me for pain management or pain help, that automatically equals opioids.
That's an interesting tidbit there. I know that there are some, I've experienced myself and I've seen it in the groups where we have, and it's, automatically that stigma of drug seeking is somehow, it's related to that word pain. And so it makes it a little bit more difficult.
Yeah. And you can clarify too, say, I'm not looking for opioids, I'm looking for pain, like myalgias, my muscle pain, or I have joint pain, or I have neuropathy pain, whatever it is, to specify and say, I don't need an opioid. I'm looking for other medications that might work for this.
Right. Sometimes just stating out your intention right up front.
Mm-hmm.
Excellent. Thank you. Lynn?
Yes. Okay. What words should I use to help my doctor do a better and more accurate muscle strength test that will help them see what my true function on a day-to-day basis is with activities of daily living? Do we insist to the doctor that they do the same multiple tests multiple times to see how weak we get?
Yeah, so this question is, I think, around the, when we do, some of us, when we do like the standard muscle test, to do it one time, you can do it fine. But then, like the muscle fatigue, I guess.
Mm-hmm. Yeah.
I think that's what the question is talking about.
It's funny. Medicine is so static, right? I think that's part of the problem with how we practice medicine. You come in once, we do your exam and say, all right, we'll see you in 2 weeks, 6 weeks, 3 months. I hope everything stays about the same or better. And that's part of this whole issue of, well, if I'm doing this manual muscle testing, it's an important part of treatment and management, but it doesn't tell you the full picture, right? If it doesn't explain or show us the issues that you have with your ADLs, your activities of daily living. So one thing that you could do is to say that, I have trouble doing this. I have trouble stepping into my tub. I have trouble getting up from a chair. I have trouble going up or down the stairs. I have trouble buttoning my shirt. These kinds of issues, they should be evident on exam as your doctor goes through it, to at least correlate it. But you can help by saying, these are the particular issues I'm having. What can we do about it? Treatment is obviously one of those, but perhaps there's something else that can be done as well. And then doing the same test multiple times in the same visit and just long-term. So in the same visit, that can be definitely challenging. I know I've done a repeated muscle test sometimes for patients just to make sure I have a detailed assessment of their muscle. Because next time I see you, I want to make sure that things aren't necessarily getting worse. And that requires us to be very careful. And definitely pain and fatigue are a part of it. And so you could say that if it becomes quite bothersome or burdensome, can we limit the testing to what's necessary? And then over time, doing the same test over and over again, I think is important, and that's how I practice. But there's different practices, but it at least gives you an as objective as we can get measure of what your strength is doing. So in one part, it's necessary and helpful. In another, you're right, it does need to be balanced with the fatigue that you feel. You don't want to feel like you just did a big workout after your doctor's visit.
Right, exactly. So all right, so is muscle fatigue measured at all with myositis right now?
No, and that's part of my research too, where
Right.
what I do is I exercise patients and see where the fatigue is localizing to. You may have heard the term localizing when you see your doctor. We always want to know where the issue is, and that helps us figure out what's wrong. So if we localize your disease to your muscle, then we can come up with a differential of these are the muscle diseases. So the fatigue component, it can localize to different parts of your body and different processes. So that's, other than a question, it's not typically assessed unless we do a few biochemical tests, like looking at your thyroid function. But I think it's more complicated than that and does need to be looked into more.
Salman, I have a follow-up on that question. Should patients actually have a log where they track their activity or kind of do certain type of tests where they know how they do when they like stand up and walk, or the 6-minute walking test? Or what's your recommendation on that?
You know, those like you mentioned, the 6-minute walking test, I think those are good in like a clinical trial or a very objective way if we wanted to measure something. But I think perhaps as a patient, something may be less burdensome, and you know, that's something that you can educate me on. But doing your activities of daily living where you say, hey, you know, I walk a mile with my grandkids and now I'm having trouble. Or I used to be able to lift my grandkids and now I can't. Right? That very raw, real life situation there, I think is very important. When I hear things like that, I say, I don't care that things look okay or things are shifting here. I say, this is a major impediment to this patient's quality of life. What can I do so that you can lift your grandkids or hug your grandkids or walk with them? So I think those kinds of things are important for me. Having a log, you know, I don't think you have to necessarily go too crazy or detailed, other than saying that, hey, you know, I'm just going to make some, you can organize it however you want, but all right, day one after I visited my doctor, this is my medication, this is my regimen, this is how I feel. And then you might just have a line through several days to say, I felt about the same. And then maybe 15 days later to say, I was able to walk up the stairs today, or I noticed a difference, I couldn't walk up the stairs today, or something that's changed. I think those kinds of endpoints can be helpful to track your disease.
Dr. Bai, this is Emily. I wanted to kind of insert a little bit of explanation of where I think this question came from, because a lot of times when we're talking in our support groups about how people don't feel like the doctor quite understands their strength limitations, I will often say that when doctors test, you know, particularly like my hands, they'll say, oh, that's a 5. And so I will say, can you please do it 4 or 5 times, or have me get up 4 or 5 times? Not because I want to get tired out, but because I don't think that my initial hand strength is indicative at all. And so I've advised patients a lot of times, because for instance, my CK levels are very rarely ever elevated, and I have refractory DM.
Mm-hmm.
And so I think this question is coming from that idea that, you know, if you just look at a snapshot of a 5-minute, especially with people with refractory, that, you know, that first squeeze is okay. I think we get a lot better reaction from the doctor if they try us a couple of times. So it's not necessarily like me trying to say, here, let me walk down the hall and you can see how fatigued I get. But even just that, you know, right, sitting there, squeezing a few times, that you can see that fatigue happening so quickly. And so I'm kind of wondering, and it's the same thing, like I can walk, you know, across a room fine, but if I stand for 5 minutes, if I can walk 5 minutes, but I stand 5 minutes, it's completely different. I can't stand still for 5 minutes. And so I guess I'm wondering how you feel about that, not necessarily about studying it or anything like that, but would that be helpful to you if a patient told you that part? I got that you were saying, yeah, that would, in a big picture sense, but like in a visit, would that be helpful to you?
Yeah, you know, sometimes it is and sometimes it isn't, right? Or if there is a difference in strength, I think when I repeat things, it's either the patient said, can you check again? Or I feel like there may have been a weakness and I wasn't either isolating the muscle properly or just didn't get a good enough feel. So I'll skip, you know, I'll do the rest exam and come back to it and reassess. And so just to be detailed, that can be helpful. And then that fatigue component, right? Which is such a common complaint, but one that, you know, I'd love for you to comment if it's been addressed in you. But I think for the most part, it's not. It's something that's just noted to say, well, sorry, this is part of the disease. Eat healthy, exercise, sleep better, et cetera, et cetera. Um, so, I think that fatigue part is hard, and perhaps you run into issue too because doctors don't always know how to treat it. And when we can't treat something, we ignore it, we feel bad, we don't look at it, And so I think it's just important to at least get out in open to say, yeah, this fatigue is very bothersome to me. Can we keep track of it? Can we make sure that we don't just blame it on myositis? Is there something else that's happening that needs to be addressed? Do I have sleep apnea? Do I need to treat that? And so I think you don't just put the blinders on and blame myositis.
And that is something that I think does happen really easily with something so confusing as myositis. Is, I also have fibromyalgia, and a lot of us have other comorbidities, and so it's really easy to say, well, we don't know enough about myositis, so everything kind of gets lumped onto myositis. But I am in physical therapy for the first time successfully because I've always been injured by physical therapists before, and so I'm seeing a physical therapist who's actually going to speak next week to us about myofascial release and how helpful that's been. And I'm also seeing a doctor of osteopathy who's doing manipulation with me. And those things are actually doing more for me now than anything else has ever done in the past, because that weakness that you're talking about that appears to be part of whatever the myositis is doing to attack those other systems that aren't necessarily addressed so easily by steroids or sub-Q IG or whatever.
Yeah.
So
yeah, you're so right about this, right? Where we, you touched on such important points. It's not just your doctor or your healthcare practitioner that needs to know about myositis. Your physical therapist hopefully also knows about it and knows how to work with patients like you. And of course, this becomes so hard when you're not in a major city that has a center, and a lot of major cities don't even have myositis centers. And so I wish there's a better answer. There's, at least thankfully with telemedicine, you're able to get some kind of evaluation and connection with people who have experience with this. And working with the kind of therapies that you think work for you. And right, I think that goes along with self-care. It goes along with not being too confident or too prideful to say, well, Western medicine is the only way to do things. I think that's why it's important to say that holistic treatment of the patient is important.
Right. Thank you so much. And thank you, Emily, for clarifying what the question meant to you and your experience. So the next question, we're at 7:50. Dr. Bai, do you have a hard stop time at 8?
We can go a few minutes over, no problem. I will try to not talk as much.
No, that's okay. So how can your doctor help to determine if you should stop working a full-time job and the steps to obtain company-sponsored long-term disability insurance and or Social Security disability insurance coverage? This is an IBM patient.
Yeah, it's important, right? You need to make sure that you still have the care that you need, the financial sustainability. I think you work with your doctor to go over the requirements to check off and see, do I qualify for this, or what needs to happen for me to qualify, so that you're aware when things change with IBM, as they unfortunately inevitably do, to know that, all right, this is the time point where I do qualify now. Some different offices have different support staff to help with that. And so I would just be ask about it, do your own research, and see if there's other resources that can help you.
Thank you, Dr. Bai. Next question, and I think you've touched on this a little bit, but I'm going to read this out to give the context. But in this instance, person with IBM, coordinating care between different healthcare organizations has been more than a challenge. An ER experience where none of the doctors had heard of IBM and did not bother to contact my neurologist after I had provided all contact information left me shaken and deeply disturbed about their lack of knowledge regarding appropriate care for me, and their lack of listening skills as well, preferring to talk to someone else who was in the room as though I didn't even exist. I changed medical groups on the spot. It wasn't easy, but I did it. But what else can I do?
Yeah, that's a tough situation. I don't don't want to speak poorly about any healthcare worker or patient or anything like that. Just to explain the context from the ED folks, they're always running around. They're always feeling like they're short-staffed. There's so much happening, and there's emergencies that they're running off to, and so I can understand the rush feeling that you may have felt. It's hard, IBM. You go to rheumatologists and neurologists, and sometimes they're not well aware of the disease, and it's just a different skill set in the ED. What else can you do? I think having that printout of like, this is my disease, keeping it relatively succinct, and these are my meds, this is my doctor. The ED provider may have thought that at least to treat the issues at hand, it wasn't necessary to contact your neurologist. These are all issues of our healthcare system, unfortunately, and unfortunately that means that you and your caregiver have to be your best advocates. So, my recommendation to my patients is to have that sheet with them in case someone doesn't contact me. But that can be helpful to just get your message across. This is who I am. I apologize that you went through such an experience. It's never good as a patient to just feel like you're just some random disease and no one's listening to you. So hopefully things can be better next time around.
Thank you. Next question is, how often should I see a neurologist, and what do I need to discuss with him or her from an IBM patient?
Yeah, it's a little bit up to you and your neurologist. Sometimes things start to get spaced out more and more if IBM is slowly progressive. You're noticing that I'm not putting dates to these things here. The reason is that it's what I tell my patients is, if something changes, call me and I'll fit you in. If something, we scheduled a 6-month visit or a year visit, or if I feel like there's a need to follow more closely, then I'll schedule more rapid visits. What you discuss with your doctor, I think, is related to your goals, what's not being addressed. Are there any trials that I should know about or upcoming? I think that kind of rounds out how I would approach those visits, because it's at that point, once you know the diagnosis, it's very problem and goal oriented. What can I do to help you, and what is it that you want that I can help you with?
Thank you. Next up, I've seen 2 neuromuscular specialists. Now we're talking diagnosis and treatments, but did not have a diagnosis. I've tested positive for anti-NT5C1A when I first saw the first doctor, but then he moved out of state. The second specialist I saw was sure I didn't have IBM. All other labs negative. First biopsy was not conclusive. Have had EMG and MRI. I'm now experiencing more symptoms, but I don't feel heard by my latest doctor. I may see another specialist. It's been 6 years since this first started, and I'm feeling discouraged and disheartened.
I'm sorry to hear about your journey and your discouragement and disheartedness. It's especially made worse when you don't feel like you're heard. I think that patient-doctor relationship can be therapeutic even if you don't have a diagnosis, right? It's a work in progress. But if that initial connection is not there, it can make it particularly frustrating. This speaks also to the problem of myositis, right? You basically listed every test that we do to figure out what it is, and it's either inconclusive or positively, truly positive, or falsely positive, and things may or may not be fitting. I would say that sometimes it takes time. Sometimes it takes the right doctor. Sometimes it takes, it's a patchy disease. It can flare or change. And so it just requires vigilance. It's frustrating. I wish I had a better answer for you. You may have to find someone else. You may have to keep working with who you're working with and give it time. But it is sadly a very difficult disease to diagnose sometimes.
If I might, Dr. Bai, so say you had a muscle biopsy and it was inconclusive, and what would another biopsy at some point be something that you would consider?
Yeah, I think so. Right, the tissue is very helpful if the rest of the clinical picture doesn't match, is not slam dunk for it, and we oftentimes need it. So what I would do is make sure the right muscle is being biopsied. So if it showed EMG changes, um, you don't always biopsy the same muscle because it can cause issues, but CK is elevated if they have weakness in that muscle, but not full weakness. So you may, you have a 4 out of 5 strength, something like that, meaning that you're anti-gravity and can withstand some force, but not full force. The MRI can be useful to locate a muscle that's weak and affected or just affected. So, I would consider it again, especially if I'm trying to nail that diagnosis and it's still not clear.
And who would be responsible for making the decision on which muscle to test? I'll just give you a quick scenario. Say, I'll just use my experience. They tested, like my rheumatologist just ordered a muscle biopsy of my right thigh, and then I was sent to a general surgeon who did just that.
Yeah.
So is that common, or do you typically look further, like through MRIs or, like you said, through EMGs to find a more specific muscle, or is that typically how it goes?
No, I think that's great. And the goal is to localize a muscle that's not healthy. And so if we can't do it clinically or electrophysiologically with the EMG, the MRI can be useful to say, hey, even though this muscle is not fully weak or we're not capturing it, there's changes on MRI that suggest this muscle is affected. So the ideal situation is where your primary team member, your rheumatologist, neuromuscular specialist, will either, if they're doing the biopsy themselves, they mark which muscle they want to do, or they specify to the surgeon that I want this muscle biopsy. Can you please biopsy it?
Perfect. Thank you.
We'll be finished here in a few minutes, it looks like. This is our last set of questions. I'm living with calcinosis for 33 years. I was diagnosed with juvenile DM. It's been a struggle with Raynaud'S and systemic vasculitis as well. It covers 90% of my body. What are the new treatments?
Calcinosis is such a tough disease. It's tough for multiple reasons, right? It's very painful, but it's also very visible, and it can be tough for patients. I'm sorry that it's affecting you so much. Unfortunately, the treatments aren't that great for it. We have our first and second line that seem to potentially be helpful. Overall, we want to control the inflammation in the disease, make sure your electrolytes are balanced properly. But outside of that, with ongoing trials and work, it hasn't been the greatest solution. But I would keep hope. There's lots of research going on. We know it's a big issue, and that's something that we work towards. To dovetail off this question, there's a question down there about recommendations for treating Raynaud'S. And I think there's a few things for Raynaud'S that we can do. One is to try and keep them warm with physically, right? So if you have a hand warmer or cover it, that can be helpful to help prevent the issues. And then these things have probably been tried in you, and if they're not working, then we move towards other agents that aren't so effective. So calcium channel blockers we first use, and then we start to go down the list of other medications, which I imagine your dermatologist has tried. But that can be tough too if we've gone through all the list of medications that we normally use and you're still not getting relief from it.
Thank you. Next question. What else can I do when I've received high doses of prednisone, Imuran, IVIG, Rituxan, Cytoxan, candy.
Too many medications.
Batacept trial, but no improvement. Recently lost my ability to get up from a lift chair and walk. This is my 6th year in this battle. What should I do? What else should I do?
That's a tough course there with immune-mediated necrotizing myopathy. I assume it's either SRP or antibody negative, and those can be very difficult to treat. I think you've gone through the list of medications. There's trials ongoing. There's research ongoing about how to treat this further. That can be an avenue. I don't know your full chart, so I can't fully comment on what's next in terms of line of treatment. The other thing too is make sure the right diagnosis is there. I imagine it is with the diagnosis of IMNM, but that's something that I've come across with misdiagnosis, and it turned out to be a limb girdle muscular dystrophy. But unfortunately, that SRP, the other antibody negative, can sometimes be quite difficult to treat. Sometimes they're associated with malignancy, so making sure that's not there either.
I have a lot of hair loss down the middle of the hairline and almost bald. What is causing this? I'm taking methotrexate and prednisone. Could it be that I'm taking too much of that medicine?
Well, unfortunately, that's a side effect of methotrexate. People take folate with it to help prevent some of the issues related to methotrexate, but it typically doesn't help the hair that much. That's a discussion with your doctor too. If it's become bothersome, there's other medications that we can use for polymyositis and myositis in general. So that's an option. But you may decide that my disease is very well controlled and I don't want to change around my medications. So that's this whole goal-directed conversation, right? This patient-centered care. What's important to you? Just because your CK is normal, your strength is good, but you're balding and that's embarrassing, that's difficult to live with, right? That's something that should be addressed and thought about and carefully planned on how you're going to treat that. I'm going bald, unfortunately, but it's not because of methotrexate, but these things happen, but they shouldn't just be pushed aside, right? So that's something that you should talk to your doctor about.
Thank you. And finally, is there anything encouraging for IBM?
We're all hoping and waiting for that. There's several trials in the pipeline. Dr. Greenberg at Brigham is working on one, and I'm hopeful that would be helpful. It's a strange and sadly interesting disease, right? I'm sure you've heard that, where you don't necessarily want to be that interesting case, but the fact that it's interesting, I think, is garnering lots of research towards it, which hopefully there's something that we can come up with that can help slow or stop this disease.
Excellent. Thank you, Dr. Bai. There are a couple more minutes if you have a couple more minutes. What is your opinion on myositis patients taking creatinine to gain back muscle?
It hasn't, perfect. So thanks for reading those questions. It hasn't shown to be particularly helpful. So there's no evidence necessarily to help support it. So that's what I'd say about that. But, continuing your normal exercise and physical therapy can be helpful, and then getting the disease under control.
Great, thank you. Trying to taper down from prednisone if rheumatologist isn't helping, is it good to consider an endocrinologist, someone to balance the meds?
Sometimes I work with endocrinology if I'm worried about the side effects of steroids, and they're extremely helpful. The steroids, I imagine, are being titrated to your disease state, and that's the hope. And then having another medication that's a non-steroidal immunosuppressant. I would just talk to your doctor to understand why the medicine is being changed or not changed, and what your goals are. All right, if you want the medicine to, hey, this is causing issues, I really need this to go down, can we try a different medication? Just voicing that concern, I think, can sometimes help us not fall into a rut, right? We're like, hey, you have myositis, things look good, I'll see you in 3 months.
Right.
When you ask something like that, that whole copy paste thing with the chart and all of that stops us to say, wait a second, why don't we go down on your steroids?
Good answer. Thank you. Preeti asked about healthy diet and related to protein. Do you think eating a little more protein than recommended amount for your age group helps muscles?
Our body needs protein, calories to help rebuild muscle that gets injured. I think if you just, not necessarily even focusing on eating extra protein, if you're eating healthy, you're going to hit your daily recommended amount. And I think just sticking to that nutritious plan, right, avoiding processed foods the best you can, having a very diverse diet. Fish, I think, is a great source of protein. and there's great vegetarian options for protein as well. Can help, but eating excessive protein or even a little more than normal hasn't necessarily been shown to help. I'm not sure it's been studied that way either. I think that'd be something that could be looked at, but nothing that I know about.
Great, thank you. Lori would like to know, have you found any alternative therapies that have been beneficial in myositis or muscles?
Yeah. Great question. And I think it's important to define beneficial. Alternative therapies, I think, are great. They should be used, but they should be discussed with your doctor. The alternative medications, right? So non-pharmacologic medications, right? They haven't necessarily been tested in trials. They also have side effects, and I call them medications too because they interact with Western medications, right? The traditional ones that we're prescribing you, and can have detrimental effects too. I remember so distinctly that I had a patient who had a stroke, a young patient, because we thought it was due to a supplement that the patient was taking. So when we Googled it, it popped up on Amazon, and the first review on there was, "This caused a stroke in me, don't take it."
Oh,
Who knows? Maybe it wasn't related, but just as a point that everything has risks and benefits. So that's one. And then the second is, I talked about the mental health and exercise, emotional well-being. I think if there's other aspects of care that you find useful, like massage, I think that's great to pursue. Meditation is great. You should do that too.
can sleep apnea be directly related to myositis? Can treatment for myositis help it?
Yeah, if there's respiratory muscle weakness, or if there's weakness in the muscles that are helping you breathe or in the way, you can definitely have forms of sleep apnea that should be addressed and that can contribute to fatigue. Treating the underlying issue is great, and that's the hope for myositis treatment, where if we start to resolve that, we may help some of the other issues that you're having. But in the meantime, if you need positive pressure ventilation, the CPAP or BiPAP or whatever it might be that your doctor thinks you need, that can be helpful.
Great. Thanks, Dr. Bai. I'm going to take the last two and give Jerry's voice a little rest. Yeah. So the last two questions are from the same person. I have dermatomyositis. I get internal burning sensation when I eat certain foods, for instance, cheese. Is there a connection? And then there's a second kind of follow-up question. So we'll let you do that one first.
Good question. And I think it's always just kind of like what we talked about earlier, Emily, right? Where we don't want to just blame dermato for everything. And so if there's another cause, I would just try and treat that. If you're on steroids, right, heartburn can be an issue. And so certain foods can trigger that. And you just may notice that certain foods just don't sit well for you. And so that's where a food diary can be useful to help eliminate certain foods. And then talking not just with your rheumatologist or neuromuscular specialist, but also your primary care doctor, right? They are excellent doctors, right? They deal with so many issues, and they can step out when your subspecialist is just saying that, hey, this is myositis. Your PCP can step out and say, well, let's look at this more broadly and what else could be causing this. So I think just being vigilant about that.
Great, thanks. And a lot of people with autoimmune diseases kind of have concurrent stomach issues anyway, right? So it doesn't necessarily have to get attributed to myositis, but it could be maybe somewhat related, but just not myositis.
Yeah, absolutely. It's such a complicated disease and can involve so many organ systems. And so that's why I think not just saying, hey, this is myositis, but stepping back and say, are there other causes of this organ system dysfunction or other tools that I can use to help treat the symptoms?
And that can get overwhelming too, because I know that, in the 26 years that I've had dermatomyositis, it's kind of like, do I want to just make everything dermatomyositis, or do I want to feel like I'm really unlucky because I have 20 different diagnoses in that? So it's kind of hard to handle that.
It's very challenging.
Yeah. Okay. So the last question in the Q&A that we have is, can the body become unresponsive to prednisone after a while? My CK has not decreased even with an increase in the dosage of prednisone. It's stuck in the 2000 range.
Yeah, that's such a tough issue that we deal with, right? Where we call it either it's refractory disease or it relapses. That's something that to talk to your doctor and say, how can we get that CK normal? I think that's very important. That's a big goal for us clinically, to say that we're stopping that damage for the muscle and hopefully controlling the immune system. And so, prednisone is only one piece of the puzzle. There's several other medications that we can try, and I would recommend you talk to your doctor. And then, I always say this too. I love seeing myositis patients, but when I see them, I question too, is this the right diagnosis? Because if it's not responding, you just want to make sure that you're treating properly, because immunosuppressants have risk. And so it's always worth taking a step back sometimes as a physician, and for you as a patient to perhaps ask, is this the right diagnosis? If so, what else can be done to help control that CK?
Thank you. Yeah, thanks for saying that, because sometimes, especially after many years of having a diagnosis, a doctor saying that can be really intimidating and scary and kind of like, oh, why would you want to re-diagnose? But hearing you say it in the way that you have tonight is also reassuring, because you don't want to be being treated for the wrong thing, and you don't want to be being treated for the wrong symptoms under the wrong diagnosis. Even if you have myositis and then there's other things, it's almost, hearing you the way you've explained that tonight has been really helpful to me, because I've been going through some new symptoms, and it's made me angry in some ways when people have said, well, that's not myositis. And I'm like, don't tell me it's not myositis. I've had it for 26 years. But hearing the way you've said it tonight has really given me a different perspective on it. So I appreciate that a lot.
Oh, good. Well, thanks for sharing your thoughts about it. One last question came in here about vision changes with myositis. Typically not, but it depends. The checkpoint inhibitors can sometimes cause this facial myositis, and patients get issues with that.
Steroids and high glucose do blur my vision when my glucose is high. I will just add that as my experience.
Yeah, absolutely. Thinking directly of myositis, not typically, but some of the medications we use, right? Well, you have steroids, you got Plaquenil. So those are important things to consider.
Thank you so much. Looks like we're at the end of the questions. I appreciate your time and going a little bit over. It's truly appreciated. Just excellent comments in the chat. Everybody's in love with you like we are. So, we're all a big happy family right now, and it's good to have you on the team. And I hope that you didn't feel you had to defend the entire medical profession during this chat, but we wanted to be sure that the questions were, like you said, they were real and they were raw.
Yeah,
they're not directed at you.
I'm sure I'm guilty of doing things that patients don't appreciate, and the big picture here is, I think we're just all a team, and you want healthcare workers on your side, right? And I think that's the goal as a patient, to have a team that cares about you and understands you.
Absolutely. Thank you so much. And Rhonda just adds great experience and wonderful hearing a fresh myositis voice.
Yeah, thanks. I've had excellent mentors talking about myositis for some time now, so I'm just trying to keep that rolling.
Certainly appreciate it. Manuel, did you have anything that you'd like to add?
No, I think that was great. I think it's Myositis Awareness Month, so it's great to have this session this month, and I think we'll continue the series. So thank you, Dr. Bai, for this opportunity, and thank you for all the participants as well.
Yeah, thanks everybody for joining and having me.
If you could just forward to the next slide, which is just a reminder that this is the start of a new series that we want to try to emulate the success that we've had with exercise in place. So a lot of what you heard today from Dr. Bai will be focused on its own webinar down the road. We'll try to do one a month, but we'll see how it goes. And in the box on the right, you can see some of the ideas we have for topics coming up. And I think it's exciting. I'm excited about it. We'll have to do some research on some of this. We want people talking who are the experts, who are doing research in this area and can talk with some authority and some insight and compassion and understanding about what we live with on a day-to-day basis. The other thing is, before I go, I'd like to ask Dr. Bai, if you're still around, one of the things that we will be doing, you will see us doing a lot more surveying of the community on behalf of research that we want to promote, patient-centered research. And I know one will be coming up in mid-June, and that's related to some information that Dr. Bai wants to get. So, Dr. Bai, if you want to talk briefly about that survey that we'll be promoting.
Yeah, sure. Thanks for mentioning that. The goal of that is to get a hold of information that's important to you and what you want to see and what's not being addressed in your care. So it's related to pain, stigma, not feeling involved with family, how you think your financial status might be affecting your care, right? All of these things I think are important, under addressed and not well known. And so understanding that information can help us and help other doctors treat it in the long run.
Thank you. Jerry?
Yeah, that's so exciting. So stay tuned for that. We'll be, sending out announcements when that's ready, and we appreciate your participation. It does matter. It makes a huge difference. So again, Dr. Bai, thank you so much. Emily, did you have anything that you wanted to close with?
I just want to tell everybody, thank you so much for joining us. Dr. Bai, thank you for being with us as our advisor and for this wonderful seminar. And also to everybody, please make sure you check out our Awareness Month activities. We have so much going on, and I'm having fun getting everything out there. We hope that you are enjoying the information we're putting out and the activities. And we are trying to just make sure that you have enough information to share with your family members and your friends about MSU and the work that we're doing, as well as myositis in general, so that you can make sure that your family members and friends know what you're dealing with, because the more we can explain to other people, the better support you can have. And so we're working hard to help you with that. So thank you, everybody, for being here tonight.
Perfect. Thanks, everyone. Have a wonderful rest of your evening. Dr. Bai, thank you. Good night, and we look forward to seeing you again. And you can visit our website, guys. Understandingmyositis.org has all of our upcoming events, awareness, fundraising. If you're able to make a donation to MSU, gosh, we certainly appreciate it. If you are unable to donate, that's fine too. We have fundraising opportunities. You can create your own fundraiser. There's various ways that you can help fund the work that we do. We are all volunteer nonprofit, so your donation is tax deductible in the U.S. So with that, I will once again say good night and thank you.